Welcome to the offices of Dr. David Saadat. Dr. David Saadat is double board certified, which means he specializes in both ear, nose, and throat surgery, as well as facial, plastic, and reconstructive surgery. I had the opportunity to sit down with Dr. David Saadat and learn about his specialties. So doctor, what is sinusitis?
Sinusitis affects 37 million people in the U.S. It's one of the most common problems. People who have sinusitis complaining about drainage from their nose, sinus pain and pressure, postnasal drip, difficulty breathing, nasal congestion. Sinuses are located around the nose, and they have a small drainage system that drains inside the nose. People who have chronic sinusitis typically have these drainage systems blocked.
So what are the advancements in treating sinusitis?
The latest advancement in treatment of sinusitis is balloon sinuplasty. It's kind of like angioplasty that has replaced some of the open heart surgeries. And basically what that means is that you insert a tiny little catheter that goes inside the nose into the openings of the sinuses, and by inflating the balloon at the end of this catheter, the sinuses are unblocked, and therefore permanently relieving the symptoms that these patients have.
What are the benefits of this procedure?
Oh, it has a lot of benefits. The most important benefit is that you can do it in the office without doing any general anesthesia. It's a very quick 1-hour procedure. There's no downtime. You don't have to have a big, huge sinus surgery where you have to open the tissue and break bone. It's just simply inflating the balloon and opening the sinus cavities.
Would you recommend this procedure for most patients?
Each patient that comes in the office, we do a full evaluation. The major one is a CAT scan that shows the drainage system. And if the sinuses are blocked, then we offer them this balloon sinuplasty.
Welcome to the offices of Dr. David Saadat. Dr. David Saadat is double board certified, which means he specializes in both ear, nose, and throat surgery, as well as facial, plastic, and reconstructive surgery. I had the opportunity to sit down with Dr. David Saadat and learn about his specialties. So doctor, why are more and more people opting for a mini facelift?
Everyone who comes in for a consultation is scared of this pulled wind tunnel look. So when we do a mini facelift, it avoids that look entirely.
So what kind of look does this procedure give your patients?
It gives them a very natural, non-surgical, rejuvenated look.
So what are some other benefits of this procedure?
It has a lot of advantages. The biggest advantage is that it does not require general anesthesia. It can be done in the office under local anesthesia. The downtime is very minimal. Most patients get back to work within a week or so. The surgery is very quick. It can be done in about an hour to 2 hours. And because of that, it's a lot more affordable than a traditional face or neck lift.
Would you recommend this for an older or younger clientele?
It can be done for anybody. Young patients can benefit from this for just needing a tiny, small lift. And older patients who do not want to go through a major facelift can have this done to get a little bit more rejuvenated and a refresher look.
Welcome to the offices of Dr. David Saadat. Dr. David Saadat is double board certified, which means he specializes in both ear, nose, and throat surgery, as well as facial, plastic, and reconstructive surgery. I had the opportunity to sit down with Dr. David Saadat and learn about his specialties. So doctor, your offices have state-of-the-art equipment. You're known for your nose reconstructive surgery, as well as your functional nasal surgery. What are some nasal procedures you offer?
We do a wide variety of nasal procedures. The procedures are performed for snoring issues, deviated septum, cosmetic nasal deformities, nasal reconstructions after trauma, bites, skin cancer, combination of all these procedures together, including endoscopic sinus surgery.
I'm sure you have several success stories, but does one stand out in your mind?
Here's an example of a very attractive individual who had 2 procedures in the past, leaving her with a very unattractive nose. This required an extensive reconstruction where we had to take cartilages from behind her ear on both sides. Her nose was opened, the cartilages were put together, and then placed inside the nose to recreate a brand new nose that looks better and breathes better.
And can these surgeries be combined, cosmetically and reconstructive?
Yes, of course. Every nose that is treated, special attention is given to both um, cosmetic aspect of it and the functional aspect of it.
Welcome to the offices of Dr. David Saadat. Dr. David Saadat is double board certified, which means he specializes in both ear, nose, and throat surgery, as well as facial, plastic, and reconstructive surgery. I had the opportunity to sit down with Dr. David Saadat and learn about his specialties. So, doctor, in your professional opinion, what's the most important thing in nose reconstructive surgery?
Well, I specialize in ear, nose, and throat surgery as well as facial plastic surgery. So naturally, the most important thing about the nose is one that looks good and breathes well.
So who's the ideal candidate?
The most ideal candidate is someone who's been ready to have this procedure done. Someone who wants to go from good, better to best.
So what are your patients' reactions when they see the results?
I've performed thousands of nasal surgeries. It's the most rewarding reaction when the patient first sees the result.
Rhinoplasty is as much as a surgery as it is an art. Do you agree with that?
Oh, absolutely. Rhinoplasty is considered the most intricate, detailed plastic surgery that we perform. And that's because the nose is the most important feature of the face. Every time you change the nose, you have a dramatic change in the face. And by sculpting the nose, you have the perfect combination of science and art coming together.
So how have your years of training perfected that natural-looking end result?
I've done 14 years of training, concentrating on nasal surgery. And then in my practice, I've tried to perfect the outcome in every single procedure.
What's your philosophy in rhinoplasty?
Rhinoplasty is the perfect combination of art and science, and I do believe that every surgery should be my masterpiece.
Welcome to the offices of Dr. David Saadat. Dr. David Saadat is double board certified, which means he specializes in both ear, nose, and throat surgery, as well as facial, plastic, and reconstructive surgery. I had the opportunity to sit down with Dr. David Saadat and learn about his specialties. So, doctor, the latest trend is the Brazilian butt lift surgery. What's your opinion of this procedure?
I love this procedure. I think it's one of the most amazing procedures that we do now. It's one that allows us to perfect the entire body by removing fat from unwanted area and placing it in the areas that we desire more of augmentation.
So what areas of the body are affected?
It affects the entire body. We can remove fat from unwanted areas, including the arms, the forearms, the chest, the abdomen, the waist, the flank, the inner thighs, outer thighs, saddlebags, calves, cankles, and we can replace this unwanted fat in areas that we really want the fat to be, including the buttocks area.
So what are patients' response to the results?
They love it. These are the patients who realize that they can't achieve these results by just dieting and exercising. This procedure allows us to create this hourglass figure that they've always been looking for.
Welcome to the offices of Dr. David Saadat. Dr. David Saadat is double board certified, which means he specializes in both ear, nose, and throat surgery, as well as facial, plastic, and reconstructive surgery. I had the opportunity to sit down with Dr. David Saadat and learn about his specialties. Doctor, I've read body contouring is the new liposuction. Patients can stand, sit, and look in the mirror during the procedure. How is this possible?
Well, with the advances that we have in liposuction, we can perform these procedures under local anesthesia. So the patients are awake, they're able to participate in their procedure. Oftentimes we realize that when you do liposuction, the traditional method, they're laying on their back. But with this type of liposuction, they're standing, they're sitting, whatever position reveals the fat. And therefore, we can do a much better job by taking the fat in those particular positions.
What are the advancements in liposuction?
Well, in the past, we used to use big cannulas attached to a huge liposuction machine. We now like to think of this as a very customized, tailored procedure for the person. We use a tiny little cannula attached to a syringe. It's done by hand, and it's done by gradually sculpting the areas of unwanted fat.
So who is the ideal candidate for this procedure?
Anybody, but for the most part, these are the people who have areas of fat that they can't get rid of with exercising and dieting. It's been there all the time. Even though they might have a perfect weight, but they still have these unwanted areas they can't get rid of.